Hi there, my name is Vic Veer. I'm the head of the sleep surgery department at the Royal National ENT Hospital in central London, and my job on the NHS is to help people with obstructive sleep apnea. Now, in one of my previous videos, I talked about a questionnaire that I made or invented called the STAMP Questionnaire. The reason why I did this is that I had an awful lot of frustration with some of the questionnaires for sleep medicine, and what I wanted to do is something that I thought was more useful for the type of patient that I was seeing. So what I did was to develop this questionnaire is that I brought in 200 people, all these people with obstructive sleep apnea. I asked them, look, what are all the issues you have with obstructive sleep apnea? I want to know everything. Do you wake up at night to go for a wee? Does it make you feel depressed? Are you tired? Every single question I could think of, every question that they could think of. And what I did was I tabulated it all 200 patients. And then what I did was I picked out the top 20 questions that defined people with obstructive sleep apnea. I looked at these questions, I thought, well, actually, I can divide these further. Some of them I put as symptoms because I couldn't fit them into anything else. Then T for tiredness in the stamp, A for alertness, M for mood, and P for psychosocial. And so these were the different domains, and there are lots of these 20 questions in between. And what I said to people is, score each one of these questions out from 0 to 5. So what you end up with 20 questions, 0 to 5, you get a score from 0 to 100. So I found, I'm a simple surgeon, I find 0 to 100 makes much more sense to me than sort of 0 to 24, like the Epworth score or things like that. It makes more sense to me. So it helps me work out exactly where I am on this scale as well. So if I see someone who's like less than 20, I think, well, that seems very normal. But the main point of it is not to work out whether or not you have sleep apnea or not. That's not the point of this questionnaire, because we've got the stop bang for that. That's well validated for this. What I really wanted this for is to sort of describe the experience of having obstructive sleep apnea, because I found that a lot of people were saying, look, I've tried this treatment and I feel a bit better. I'd like to know how much better they feel. For example, if you were to use CPAP for maybe 2 to 4 hours each night, I noticed that people feel less tired. So the tiredness domain starts getting a little bit better, but they still feel not very alert and their mood is still poor until they start using CPAP, say 7.5 hours each night. So you can see sort of slightly more detail in how they're getting better and how they're not getting better. And some people just don't realize this until they do a questionnaire like this. But I think more importantly, some people, like, I'm using CPAP, I know that my numbers are good, but I just don't like my life. I'd never thought of myself as someone who'd be using CPAP for the rest of their life. And that psychosocial domain is like, look, I'm embarrassed about my sleep problem. I worry about this, and all those sorts of questions I put into the psychosocial because I think that's important. Psychosocial things are really important. We talk about and we treat these problems in medicine all the time. For example, if someone came to me with a blocked nose, if I removed that person's nose completely, just a big hole here, they'll be able to breathe great. But the psychosocial effect of not having a nose would be awful. What have you done to me? I know I can breathe, but I can't go out in daylight like this. People would see me. It has to be extreme version like that. What about things like poor women who've had breast cancer, they've had their breasts removed? We reconstruct breasts, erectile dysfunction. What about after COVID, people have lost their sense of smell and they can't taste food anymore. None of these things are going to kill patients, but they're important. They're useful, and we treat those things. Why would we not treat sleep apnea patients? It's not fair. I don't think it's fair anyway. So what upset me particularly was that patients would sit down in front of a doctor and say, look, I am using the CPAP, but it doesn't work for me. I'm not happy with it. My life is not good. The doctor would turn around and say, but your numbers are good. What are you talking about? And the patient says, but I don't like it. And then because the problem is they're not communicating with each other on the same language. They're not talking the same language. And that's what I was trying to change. I was trying to explain to people, look, these people have got a problem. Their numbers look good, but they're still having problems. And you'll know from some of my other videos that I get very angry about the fact that people are defined by their AHI. The AHI is the number of times you stop breathing per hour. So somebody, oh yes, your AHI is 20, you're moderate to severe obstructive sleep apnea, you need the CPAP mask. Oh, it's better now, well done. And so, but some people are not happy with that. And so defining someone's experience of obstructive sleep apnea with a single number, I don't think that's fair, because it's such a big topic. It's such a huge thing. There's so many different life experiences with obstructive sleep apnea. To try and narrow it down to one number, that's not right. And I don't like it. And the other thing is that the AHI is not very good. You look at someone's AHI and go, oh yeah, you're this number. But if you know more about AHI, if you've If you know how to look at the sleep study, you know that the AHI is a rubbish number. It changes all the time. Night to night it changes. And if you look at it in more detail, you see actually if I sleep on this side, my AHI changes. If I sleep on this side, it changes. And what I'd like you to do is look at this video here, which teaches you how to look at your own sleep study. And when you can read your own sleep study, first you'll realize that the AHI is a bit rubbish and the number is almost meaningless. You need to look at the whole detail of the sleep, your respiratory effort, how much effort you take to breathe, how low your oxygen gets, and what position you're sleeping in that night. All of that stuff is really important. That's the sort of detail I think people need, sort of own their disease so they can have power to sort themselves out rather than just relying on this single number that sort of defines them. I don't like that at all. And I feel like I'm starting to rant, and I really have to stop now before I start silly things. So I'm sorry for ranting. Do take care. Thank you very much for watching this video. Bye-bye.